Hello everyone, it's Wendy at MUTU System here. Thank you for joining me. Today we are covering pelvic organ prolapse and everything you need to know about it. First of all, thank you to those of you that were expecting this last week. I'm really sorry we had to postpone that at the last minute, but we've had even more questions because we had sort of 2 weeks run up to this one. So what I want to cover for you today is pelvic organ prolapse. Now, we've had so many questions that what I'm going to do is, rather than kind of run through everybody by name and read out all the questions, what I'm going to do, because the questions all kind of fall into certain categories, okay? So what I'm going to cover, which will cover all of the questions that we've been asked, are: what is it? What are the types of prolapse? What does it mean? What are the different grades of prolapse? What are the causes of prolapse? What are the feelings and signs and symptoms of prolapse? Treatment, obviously, what you can do. Exercise, what exercise helps, what exercise won't help, what you should avoid, what you can do, what's safe, what isn't, who you should be referring to, who you should be consulting with, all of those things. So I'm really hoping to cover everything that you've asked, because I know that this is pelvic organ prolapse is a subject which is not discussed enough in terms of, well, quite clearly from the number of questions, women don't know enough about it. But it is, unfortunately, a very common condition. Some research suggests that up to 50% of women will be dealing with some level of pelvic organ prolapse at some point in their life. So this really is something that we need to know about. We need to be educated about our own bodies, about what to look for, what we can do preventatively, how we can help ourselves, and obviously to just understand. I mean, everything that we do here at MUTU is about empowering women with the information that they need so that they can understand their own bodies, right? So that's very much what we're going to do. So let's kick off with some definitions, okay? So what actually are we talking about? What is it? So the organs of your pelvis are your bladder, your vagina, your uterus, your rectum. These are the organs of your pelvis. Now, they are held in place by a number of structures. Now, your pelvic floor, underneath these organs, obviously your pelvic floor is very much part of this supportive structure and system, but it's not all there is, because there's also a whole bunch of fascia and muscle systems and ligaments, very important ligaments, holding these organs, suspending these organs, if you like, in your pelvic cavity where they're supposed to be. All right, so there's a whole system there supporting these organs in your body as they're supposed to be in order to be functional. And those muscles and fascia and ligaments, they are joined in some part to the bony structures of your pelvis. So by the bony structures, I mean your coccyx, your tailbone, the ischial tuberosities, your sit bones, your pubis at the front. So there's bones within your pelvis, and then there's a whole bunch of ligaments and muscles and fascia systems all working, including your pelvic floor, to hold those organs where they're supposed to be. A pelvic organ prolapse is when one or more of those organs is no longer being supported. Okay, so the support structures have in some way been compromised, and something is descending to where it shouldn't be from where it should be. That is a pelvic organ prolapse. So the supportive structures holding those organs in place, those vital organs, is compromised. So there are different types of prolapse. Now, I'm not going to get too into sort of medical descriptions of each type, because this would be something that you would discuss with for an individual diagnosis, and we'll talk more about how you get one of those later as well. But there are a number of types of prolapse, because the organs within your pelvis can prolapse or fall or be unsupported in various ways. So you may have been told, if you're dealing with any of these, you may recognize some of these terms. So a cystocele is a bladder prolapse. So what that means is that the bladder, the structure, that organ has prolapsed or fallen into the vaginal wall. All right, so it's kind of bulging into the vaginal wall. There's a rectocele, where the large bowel or the rectum is bulging in towards the vaginal wall. There's a vaginal vault prolapse, which is where literally the vault of the structure of the vaginal canal kind of caves in on itself and starts to descend. There's a uterine prolapse where the uterus starts to descend into the vaginal canal. And there's an enterocoeli where that's more an intestinal prolapse. So these are, you don't need to know all of those because obviously it's kind of, if you're dealing with a prolapse, then all of the advice that I'm going to give you and all of the information I'm going to give you will apply. But what I just want to do there is just demonstrate that there are a number of different ways that this can happen, and you may be dealing with one or more of those. So more than one of those organs may have prolapsed. Now, prolapse is sort of described or graded in medical terms on a scale of 0 through 4. Now 0 is everything's where it's supposed to be, okay? And these are grades of severity of prolapse. Now grades 0 through 1 and into 2 essentially means that the organs have prolapsed, they have descended within the pelvic cavity, but they are still contained within your body, if you like. When you start to get to grades 3 to 4, you are likely to feel or even see organs coming out of your body. So they are protruding outside of your body, probably outside of your vagina. All right, so there's different grades, and the treatment that would be prescribed or suggested varies depending on the grade of prolapse that you're dealing with. And it's important to note that there are many cases where treatment in terms of medical intervention treatment would not be recommended and are not necessary. And so for that, we're kind of talking grade 0, 1, 2. It is highly likely that you would be more, that some of the strategies and exercise strategies that I'm going to talk about will be more than adequate to ease any symptoms that you're having, and really medical intervention in that way will not be necessary. So medical intervention is more likely to be suggested or recommended at the higher end of that grade scale. So at grades 3, 4, when one or more of those organs is descending to actually come outside of the body, and that is obviously uncomfortable and upsetting, and we'll have a number of other symptoms which we'll talk about. So that would be when surgical intervention might be recommended. So there's kind of this scale that goes with these gradings. There's a scale of recommended treatments or strategies that will ease your symptoms, and there are many of those strategies that can come into play before surgery becomes a necessity. All right, I'll talk about who would help you to make that decision, if you like, as to when surgery is necessary and what that. I'll talk briefly about what that might involve. But there are initial stages of prolapse, and when I say initial stages, because you have a grade 1 or 2, it does not mean that you're going to develop a 3 or 4. Okay, it's not. You can start to put in place techniques and strategies and changing some habits and way that you're moving that can relieve those symptoms, and your prolapse never needs to get worse. Okay, so do understand that if you're sort of dealing with some of the initial signs and symptoms and feelings that I'll talk about, it doesn't necessarily mean that you are inevitably headed for a full grade 3, 4 full prolapse requiring surgery. All right, there are many grades, and many of those grades will not ever require medical intervention. So what does it feel like? How do you know if you've got it? So many of the questions that came in kind of were around this kind of area, which is, how do I know if I've got it? What does it feel like? So let me talk through some descriptions and some feelings that you might be that may suggest that you are dealing with some form, some grade of prolapse. If you are feeling any kind of pressure, certainly, and pain, definitely. If you're feeling pain, you definitely need to consult with a medical professional on this, and I'll talk about who. Pressure, dragging, fullness. Many women describe the feeling of sitting on a ball. like there's something between your legs, like a tampon is falling out. A tampon may be falling out, so that might be another symptom, which might be the inability to use tampons effectively. Any kind of bulging, and this is both feeling and seeing. So on that note, if you can literally feel, or i.e. with your hand, and or see anything actually protruding, then clearly there is some form of prolapse going on. Some types of incontinence. So, for instance, that feeling that maybe you don't quite empty satisfactorily, that may be urinal or fecal. If you don't quite feel like you've finished, not sort of feeling like you can't quite have a full excavation, if you like. Sex may be painful. Constipation could very well be an issue. But very much probably the most likely feeling that you're going to notice the most is this bulging, dragging pressure. And this may change through your menstrual cycle as well. So there will be, if you are dealing with a prolapse of any grade, it is highly likely, because of the hormonal changes during our cycle, that these feelings may intensify at certain times of the month as well. So that would be something to expect. What causes it? So that's sort of something else, because obviously a lot of the questions are about, can I avoid it? What can I do preventatively? Well, and very much there's often an understanding that childbirth causes prolapse, or it is highly likely, or is very common, that women are going to notice symptoms post-childbirth, and not necessarily immediately post-childbirth, by the way. That's another big point, that the symptoms of prolapse, even though they were exacerbated by the straining, etc. of childbirth, they may not kick in until sometime afterwards. So the causes are going to be excessive pressure within the abdomen, within the pelvic cavity. So again, these are issues that we've talked about before in terms of many other issues like diastasis recti, like hernia, all pressure related. So there's an alignment element to this as well, which I'll talk about in sort of strategies that you can use as well. So there's an alignment element, so it can be caused by a body that is not correctly aligned, and therefore that support of those organs has not been optimal. But yes, very much sort of prolonged straining, so such as a prolonged labour, often in assisted labour, so where forceps or ventouse has been used, that can often kind of increase the likelihood of prolapse symptoms later. So yeah, it's kind of the cause is a pressure one, essentially. It's excessive uncontained pressure. One way of looking at it is if you think about intra-abdominal pressure, which is the natural occurrence, but we need to contain it correctly through all of our core muscles. And as I say, this is an area we've touched on in lots of other contexts, talking about diastasis and other pelvic floor issues. The vagina doesn't have a sphincter in the way that most of our other outlets do. So if you think about urethra, if you think about anus, if you even think about in terms of breath holding or a lot of pressure through the throat, we have a sphincter, a valve, if you like, here. Vagina doesn't have one of those, okay? So in many ways, it's kind of when there is a lot of pressure that needs to be released, when there is a lot of pressure where somewhere's going to give, something's got to give, the vaginal vault, canal, outlet is very, very vulnerable in that circumstance. So it's about straining and it's about pressure. So we've talked a bit about what it means, what it is, which organs are involved, what causes it, the different types, the different grades. So let's talk about what you can do about it, both preventatively and if you're already dealing with symptoms. So as I said, there are a number of grades of prolapse, and so let's start with the more conservative and less invasive and non-medical, if you like, interventions that we can use? Well, clearly pelvic floor exercise is very much a part of that strategy. So when I say pelvic floor exercise, we've talked a bit about this before, but thinking in terms of Kegels, pelvic floor exercise, make sure that when you're doing pelvic floor exercises, when you're focusing on your core and your pelvic floor, that you're really focused on the foundational breathing, mindful breathing that we talk about in MUTU, that you're getting those pelvic floor exercises right, basically. Because just squeezing and squeezing and squeezing is not adequate. It's not enough. And in fact, pelvic floor exercises that are totally focused on the contract, the squeeze phase, which is often the case, that we're all about the contraction. We're all about the squeeze. And actually, a pelvic floor that is weak is just as likely to be what we call a hypotonic pelvic floor, too tight. The muscles are too tight. Very often, urge incontinence is related to a too tight pelvic floor, a pelvic floor that is contracted all the time, that's hypotonic. So don't fall into the trap of believing that in order to strengthen and work your pelvic floor that you need to tighten and tighten and tighten. That's not the case. As with any muscle movement, the relax phase, the let go phase, is infinitely as important, if not more important, especially if something's over tight, than the contract phase. So it is essential that when you're working on your core, when you're doing the foundational kind of core and pelvic floor recruiting and engaging and finding work that we do in MUTU, which is the foundation of core strength, that you're really focusing on the inhale and the relax phase. Everything must let go. And as well as when you're doing that, remember also that I talk about all the time, and I've probably brought up in every Facebook Live we've done on every topic because it's always relevant, is the way that your body is stacked. Your alignment is so important in this. So make sure that when you are doing pelvic floor exercises, it's not just the squeeze. The relax is essential. And if you think you might have the symptoms of a hypotonic pelvic floor, so urge incontinence is a example of that, like when you've suddenly got to go, then really the relax part is more important. Focus on that. Your pelvic floor doesn't need any more tightening. What it needs is to relax and work at full length. And obviously tied to that, very much tied to that, is the alignment advice and principle of not tucking your backside underneath you. We've covered this before in pelvic floor exercises, but if you tuck your tailbone underneath you, if you tuck under, you're bringing coccyx, tailbone closer to pubis at the front. You're shortening the muscle. You're shortening the muscle, and if it's permanently on short, it cannot be strong. It cannot be functional. It cannot work right. All right. If you permanently contract a muscle, it cannot be functional or strong because it's got nowhere to go when you need it. Yeah, that's the logic of it, if you like. If you permanently tighten something, if it's permanently on short, it's got nowhere to go. Okay, so every muscle has to be able to work at full length, and your pelvic floor is that's so imperative for your pelvic floor. So don't tuck your tailbone under. When you're doing pelvic floor exercises, you shouldn't be squeezing your backside. You shouldn't be squeezing your butt, your glutes. You shouldn't be squeezing your inner thighs. If those big muscles are kind of taking over, then really what's happening is that you're not really getting to those deep pelvic floor core muscles. So be aware that when you're doing your pelvic floor exercises properly, you can't see anything, okay? You can't see anything from the outside. So you should not see your butt tuck under or squeeze. You shouldn't see your hips move. You shouldn't see your inner thighs or backside clench up, okay? So pelvic floor exercises, that's a clear, massive player in your strategy to relieve the symptoms of the prolapse. Now, another really big one that you may or may not be aware of is your position when you are going to the toilet. Now, if you've followed MUTU at all, you'll be aware of our love of the squat, but also of the squatty potty. Now, if you, I'm sure we'll put a link in the comments for you so you know what I mean. But basically, it's just a step. It's something to put your feet on while you're sitting on the toilet. Now, why does this matter? Well, if you raise your feet while you're going to the toilet, then it actually puts your pelvic organs in a much more optimal position to excavate effectively and easily without straining, without pushing. So we talked about one of the causes of prolapse is excessive straining, pushing in any form, and straining to go to the loo. So if you're constipated or if you're straining a lot, that is a definite factor. Okay, so we want to get away from that straining, and actually just sitting on a toilet in a seated position, on a Western toilet, obviously, in a seated position is not an ideal position for your body to go to the toilet. So if you can raise your feet, it puts you into a more natural sort of squat, basically, position, so that you're going to the toilet in a more natural position. And what you will find, and a lot of people are really quite amazed by when this first happens, but it has a really clear, immediate effect on the comfort and ease with which you will empty yourself when you go to the toilet. It really is so much more comfortable. You won't be straining and pushing, and this is really important in cases of prolapse. So raise your feet to go to the loo. It's another really big one. Alignment, we talked a little bit about, so tucking under and all the conversations that I've had that we've had before with regards to alignment, the high heels, the sitting too much, the tucking your tailbone under. All are contributing to a position for those pelvic organs which is not optimal. So remember, when you're sitting, you sit on your sit bones, not on your tailbone. Sit as little as possible, walk as much as possible, natural movement, squatting, all of these things are going to help alleviate those symptoms of prolapse. So avoiding strain. And another thing you can do if you're suffering with prolapse, when you're doing exercises, so let's kind of come on to exercises and what you should or shouldn't be doing. Let's talk first about sort of the core phases of MUTU. So I'm talking about the most foundational, gentle, core type exercises. Now, very often we don't stay there for long, but you might be starting with supine or lying on your back exercises. Now, if you are dealing with a prolapse, what can really help is to literally just change the force of gravity a little bit on that and put a wedge. You can actually get like these kind of foam wedges, or you can literally just shove some cushions, some pillows underneath your backside, literally to raise your hips higher than the rest of your body, and then do the breathing exercises and things from there. So what you're doing is you're literally taking the pressure, the force of gravity, you're alleviating, you're easing on your prolapse. Okay, so that can make a really big difference in those sort of foundational floor-lying exercises when you're really just starting to connect with your pelvic floor and your core. Raise your backside, raise your pelvis on a wedge type shape, or on a slope. You know, if you're on a bench, if you're in a gym, or if you're on something where you can literally just put yourself on a slope with your hips higher, then you just kind of literally are taking the strain off. You're taking the gravity sort of force away a little bit. So a wedge for those exercises can be really good. So let's talk a bit more about exercise. There's a lot of questions I got. What can I do? What can't I do? What's safe and what isn't? So the first answer to that is going to be one that you'll have heard from me many times before, which is your body will tell you when you're ready what's safe, what's not safe. If when you are exercising, you are feeling any of those symptoms that I talked about, the bulging, the fullness, the dragging, the bearing down, certainly if you're leaking in any way, any kind of that fullness, dragging, heavy feeling, if you've got that at all, and if it gets worse when you do any certain activity, that activity is not currently safe for your prolapse. okay? So your body will tell you if the symptoms get worse, back up. That exercise is not okay, all right? So that's the first, I was going to say obvious, it is obvious, but way too often women exercising are ignoring what their body is screaming at them to take notice of. All right, so this is so important, and if you remember no other rule about do this, don't do that, listen to your body. If things get worse, if you are feeling symptoms and those symptoms worsen when you do an activity, that activity, your body is telling you, I'm not ready. Okay, so that's the first one. Think about your menstrual cycle too. There will be times in your cycle, if you're dealing with a prolapse, there will be times in your cycle where, for instance, if you're doing exercise that involves lifting, for example, weightlifting in any form, crossfitting, boot camp, big weights, small weights, whatever it is, if you're doing an exercise that involves heavy lifting or straining, there will be some times of the month, if you're dealing with a prolapse, where those symptoms will be a problem, and there might be times when they're not. Listen to your body. So don't kind of be surprised if maybe a weight that you can lift at one time of the month you can't at another without worsening symptoms. That's perfectly natural and normal. You're dealing with a prolapse. Listen to your body and listen to your cycle as well. Talking of lifting, any kind of weightlifting, again, there's a kind of certainly in male weightlifting, there's a lot of techniques used that involve a kind of bracing, lock, even worse, like a weightlifting belt, that kind of thing. Something that really increases the pressure in the torso. Now, I mean, there is a logic, there is a physiological logic to, if you increase the pressure in your torso, you brace yourself to be able to lift a heavier weight. There is a logic to that, but in terms of your pelvic health, that is absolutely not a good way to go. So ensure that when you're exercising, whatever exercise it is you're doing, so you've found a level of your activity that does not worsen symptoms, there's no leaking, there's no bulging, there's no dragging, there's no pressure. You've found that place. Now make sure too then that you're, as we say in MUTU, making every exercise a core exercise, so that you're breathing right, so that you're engaging your core to do the work on an exhale. All of those elements that you learn in those foundational stages of core recovery, it is so important that we don't then forget them when we're looking at a dumbbell or a barbell or a pull-up. That's the time when you really need them. It's one thing to mindfully work your core correctly whilst lying on your back on the floor, but when you really need to recruit those strategies is when you're actually going to lift something or do something that is going to strain and increase pressure within your pelvic cavity. So make sure that you're breathing right, that you're lifting right, that you're engaging your core right whilst you exercise. Listen to your body, listen to your cycle. I think that's probably it on exercise. In terms of, well, obviously another question that has been asked a lot is MUTU System safe if you have a prolapse? The answer to that is that the MUTU core phases, so that's either the core elements of the 12-week program or our separate core only focus program, are yes, absolutely safe and complementary to any care that you might be getting for your prolapse. Sorry, just got to press a button, so I hate it when that happens. So yes, MUTU System is entirely safe for prolapse. The proviso I'm going to make is if you're looking at the 12-week program, the intensive workouts are not necessarily suitable if you have a prolapse. But again, as I said at the beginning of this, there are many grades and levels of prolapse. So what is suitable for you? What is suitable for you and your particular prolapse situation needs to be assessed by a professional, and you need to, I can't tell you that at this stage of prolapse you can or can't do X, Y, and Z. What I can tell you is that the core phases of MUTU System are safe for you. They are recommended by pelvic physiotherapists the world over. You can see on our website we've got a lot of really highly respected pelvic specialists, pelvic physiotherapists, physical therapists around the world that recommend MUTU System. So yes, it's safe core work only, core phases or focus only. As soon as you're looking at the more intensive exercises, which in MUTU System we don't do anything high impact, incidentally, because you don't need to, so there's no impact in any of ours. So if your medical caregiver who has diagnosed and is treating you for prolapse or is making recommendations for your prolapse has told you no high impact exercise, then all of MUTU System is entirely safe. Okay, we have no impact at all. All core phases, safe, recommended. So let's come on to who you should be seeing. One of the questions that came in was who diagnoses this? You know, is it my OB? Is it my doctor? Is it a physio? What sort of profession? Is it a fitness professional? What sort of professionals should be diagnosing my prolapse and how serious it is and what I should do about it? The best place to start, as I always recommend, for anything to do with pelvic issues, pain, is see a pelvic specialist physiotherapist, a women's health physiotherapist. Now, if you have pain, if you have acute pain, go to see a medical doctor as soon as possible. That would always be your first port of call. Hopefully that's obvious. But in terms of diagnosing specific detailed grades and recommended strategies and treatments, I would highly recommend that you consult with a women's health physiotherapist, also known as a pelvic health physiotherapist or a pelvic physical therapist. Now, how to find those? We have a lot of resources on the MUTU System website. We'll put a link to that page underneath this Facebook Live. But we have a lot of information for you on what you should, if you're going via a doctor. That's certainly the case in the UK. If you're in the UK, then you will probably be being referred from a GP or from a doctor. But wherever you are, we've got recommendations in terms of the kind of, you know, exactly what medical expert are you looking for. You're looking for a pelvic health physiotherapist, somebody who specialises in pelvic health. And we will give you clear instructions on how to find one of those people. Now let's just go into the more serious end of prolapse, when medical intervention is required and has been recommended. What does that actually involve? Now, I'm not going to get deep into this because I'm not a doctor. I'm not a doctor, and it would certainly be nowhere near my remit to be diagnosing those elements. But let me just explain what is likely to happen. So if you are suffering with a prolapse that is at a grade 3 or 4, is causing you serious discomfort and symptoms, and if surgery is recommended, then that surgery is likely to consist of stitches and or mesh to support or lift the structures that have been compromised. Now, there is a lot of controversy about mesh surgery. I'll put a link. There's actually some good information on the pelvic guru, Tracy Sher. Tracy Sher is a highly respected and brilliant pelvic physiotherapist based in Orlando, Florida, and she's actually the medical advisory for MUTU System and our MUTU Pro certification. But she has her site is pelvicguru.com, and you'll find some great resources on there with regards to looking further into mesh or surgery issues, options, controversies, etc. If you are looking at surgery, if you are being recommended surgery for your prolapse, please, I will simply say do your research, and please make sure that you are not only dealing with a surgical doctor, but that you are also very much getting the opinion and advice and support of a specialist physiotherapist as well. Okay, sometimes surgery is necessary. There's one more thing that I didn't mention, which is kind of more of a middle ground, which is a pessary. A pessary is much less invasive than surgery. A pessary is something that would be prescribed or suggested, again, by a pelvic health physio, or a doctor may suggest this too. And it's a small not uncomfortable device inserted to literally support the organs from the inside. It can be worn safely day to day. It can be worn safely during sex, even in some cases, with some types. There are many types of pessary. Again, that is not a rehabilitation area of expertise, so I'm not going to go into the detail on pessaries, but definitely, certainly if you're being recommended or people are talking about surgery, make sure that the pessary option has also been explored, and take your time over that, and consult with a specialist physiotherapist with regards to the use of pessaries as well. So we've kind of got this grading, yeah, with this kind of grading where lifestyle changes, toileting positioning changes, exercising, listening to your body, alignment adjustments, through to sort of avoiding straining, avoiding high pressure, literally, situations, through to pessaries recommended and supported by a specialist physiotherapist. You've got all of that before you get to the surgical option as an option, okay? All of these things can work preventatively as well as easing symptoms on the way. So as I said right at the start, don't feel that if you're, don't think that just because you've got some of those symptoms on a more minor scale, that it means that you're inevitably heading for the grade 4 and the grade 3 and the total collapse and the surgery. All right, it doesn't mean that. There is so much you can do to ease those symptoms, make yourself more comfortable, and hopefully make surgery unnecessary.